Okay, class, good morning. Welcome to our human biology class. Joining me with our face-to-face class is I have here Vaughn, Jennifer, Jane, and Matt. So for today, our main objective is to do a blood typing exercise, which we call it as ABO blood typing. So to start with, we have here the following materials. We have your anti-sera A, B, D. D is referring to the Rh antigen. Then we have the blood lancet. We have the blood pricker, the glassy slide, the cotton and cotton applicator, clean tissue, and 70% alcohol. So later on, I'll be presenting you all of this as we get the blood typing of one of our patient, which will serve as our patient, Sivon. Okay. To start with the theoretical concept of ABO blood typing, I would like to start with the different blood types that we have. Okay, so we have 8 types of blood, comprises of A, B, AB, and O. Now, with that, we have 4 major groups. However, with the presence of the D antigen, referring to the Rh antigen, we have a total 8 blood types, referring to either A negative or A positive, B positive or B negative, AB positive or AB negative, and O positive or O negative. So that would complete a total of 8 blood types. Now, how are we going to differentiate between these blood types? So I'll be requesting Jennifer to explain to us how we determine the blood type in reference to the presence of agglutination and no agglutination. Jennifer, can you tell me what do you normally observe when there is no agglutination? Okay, to explain to us the blood type A, how we differentiate it from the other blood type, let me welcome Jennifer. Jennifer?
So for the blood type A, there will be an agglutination here. So there will be clumps for the blood, and within here, there will be no agglutination. And in here, there is also an agglutination. So if that is the result of your blood type, we can call it A positive.
Okay, for blood type B, let us welcome Jane to share to us how we differentiate that from the other blood types.
So, sa blood type D naman, dito nagkakaroon ng agglutination. Tapos, ito yung non-agglutination. And to determine kung positive ba or negative, ito malalaman. So, yung gagawin ko is B negative.
To tell us about blood type AB, let me welcome Vaughn here. Vaughn?
For the blood type AB, we will observe ABD, lahat po sila may agglutination. So A, agglutination siya. In B, agglutination siya. And also in letter D, agglutination siya. It will result as AB positive.
Okay, to complete our blood type, we have the last blood type, which is blood type O. And to explain that, let me call on Matt.
So sa O, no agglutination siya, so shaded part. Same as B, no agglutination din, so shaded part siya. And sa ano ko naman, blood type, which results may agglutination siya, so that. So ang magiging result niya is O positive.
Good morning once again. We are now facilitating the blood typing exercise, and I have here with me Vaughn as my patient today. So here with me are the materials. This is your anti-serum A. This is your anti-serum B. And this is your anti-serum D. Now, I have here with me the glasses slide. I have here the cotton applicator, which is intended to mix the blood sample and the anti-sera. I have here the cotton, which is good to sterilize, to apply aseptic technique to the fingertips of Von. And I have here the tissue, okay, where I place the glasses slide. Now, to start with the blood typing exercise, I will sterilize the fingertip of Von using 70% alcohol. Now, are you relaxed, Von?
Yes, ma'am.
Okay, so I want to press his fingertip, okay, so it would allow the blood to flow on the upper portion of his finger prior to pricking. But before you prick it, you have to release your thumb or your finger so that it will not the blood will not flow out. Okay, so Von, please relax. Okay, 1, 2, 3. Okay, so the blood is coming out. Let us turn it and then the blood sample will be distributed into 3 places in order for us to use the 3 types of anti-sera. Okay, so you're good. Two to 3 drops of the anti-serum is enough before mixing it using the cotton applicator. 1, 2, 3. And then this is the anti-serum B. You may notice the color, it's yellow. And then the anti-D, which appear as transparent. Okay, now we are ready to mix. Making sure that when you use the cotton applicator to mix the blood sample and the anti-sera, do not reuse the cotton applicator. It might affect the result of your blood sample. Okay, so our goal is to see if there is agglutination in here. Now, Von, can you see any agglutination in A? Do you think it mixes thoroughly, or you can see the precipitate in there representing the agglutination?
Wala po, sir.
Now, you can see the precipitate in there. That's the agglutination. So, now let's see. Majority of the Filipinos are actually positive. Okay? Now, Von has a royal blood. In here, you can see there is agglutination in A. Likewise, in B, there is agglutination, and obviously, the D in here representing being positive. So if we're going to label the blood type of Von, so this is blood type AB, and by looking at the anti-serum, this is AB Positive. Okay, so congratulations Mon with having a royal blood, AB and positive.